Welcome everybody to the Why We're Over It cash-based physical therapy series. I am super excited to have Yves Gege with us, and I am just so excited to talk to him. He has so much knowledge, and I think he's going to be such a wealth of information for you all listening at home, whether you are a prospective client looking to get some physical therapy, or you're a practitioner and maybe you want to know a little bit more about the benefits and the freedom that the cash-based physical therapy model brings. So I'm going to let Yves take it away, give you a little background about himself, and we'll get the conversation started.
Awesome. Thanks so much. That's a great name, by the way. I love it. That's so good. My story is basically I got into physical therapy because I was an athlete. I had 3 knee dislocations. I played soccer quite a bit, and I needed physical therapy. I really enjoyed kind of the one-on-one I got in physical therapy. I enjoyed the human body stuff. I'd always kind of been an athlete and into kind of exercise. That was a big one. I also had a special needs little sister. Kind of a mini background. She had spinal meningitis when she was very, very young as a baby, kind of born healthy, had spinal meningitis, and then kind of severe brain damage, cerebral palsy, and kind of a lot of operations and a lot of physical therapy kind of went along with that. So I was about 10 years old when she was born. So I really got to see what the big impact for me, and I still remember this moment pretty vividly, is when the physical therapist who would come to the home at the time when she was very young, she would always be very, very excited to see the physical therapist, right? And so, but during physical therapy is very painful, right? Like muscles are very tight. There's a lot of stretching involved. It's very, very difficult. That kind of neurological disorder, but always very happy, when she was around, and just like, again, very excited to see her. So it's just like so cool to kind of see that connection made with somebody, who kind of probably, more than likely doesn't kind of understands the ins and outs of it. Just seeing that connection with people, right? And so just had a very, very severe impact on me. So I was pretty lucky that, like, hey, this is what I want to do for a living, and that never really changed. And still at 37 years old, I still have kind of a big passion for our profession and the impact that we can have in general. So
Awesome.
So after that, you can stop me anytime too. I can talk forever, but
no, just you keep going. I'll interrupt if I need to.
Okay, cool. So I was born and raised in Charleston, South Carolina. So I went to College of Charleston, and when I was in PT school, you're able to do a 3-in-3 program. So I was a college dropout. So I did 3 years at CFC and went straight into a master's degree at the time. I don't have my doctorate, master's degree at the time at MUSC. Really, really enjoyed that. Always wanted to be a pediatric physical therapist, believe it or not. So got out of school, actually worked 2 jobs, really 3. I worked in the school system, which I loved and enjoyed. And then I did outpatient pediatrics kind of in the afternoons. And then I actually did like traditional outpatient orthopedic physical therapy in the summers. And I always wanted to own my own clinic,
Okay.
So that was kind of the trajectory I was going. After about 3 or 4 years of doing pediatrics, I got a little burnt out, and the kids was really great, but dealing with the parents, the insurance model was not, the pay model wasn't awesome. And there's just a lot of things that I didn't enjoy as much as I thought I would. And so I kind of delved into more of the orthopedic realm. I still did some pediatrics, but I liked kind of splitting my time. I had an opportunity to work at an outpatient clinic locally for a year, and then open a satellite clinic, kind of my own clinic, and partner with them within about a year's time. So did that for a year, opened my own clinic, insurance-based clinic, did that for about 4 years, and we started with just me. And after about 4 years, we had 2 or 3 PTs and PTAs and aides and all that stuff kind of working with us. And it was inside a gym. And I really enjoyed it, but I got, again, a little burnt out in that model. The volume of patients that I was seeing, the buy-in that the patients were getting was not very good. Like them doing the home exercise programs, I also just saw a lot of burnout with other people, other PTs that I was working with, between paperwork and just the quality of care that they were unable to provide at the time. I also kind of went down the strength and conditioning rabbit hole when it comes to CrossFit and strength training, things like that. So I decided to honestly sell that practice and start completely over in a CrossFit gym after about 7 years. So and completely restarted and kind of was thrown into the cash-based model because in an insurance-based model, the amount of volume that you need to make any money is extremely high. And I was one person in one room in a CrossFit gym. So this cash model was fairly new. And I was like, well, I literally can't, I know what the insurance model is like. I don't really like it, but I couldn't even do it if I wanted to with the means that I had. So I went all in the cash-based route, kind of, again, started from scratch, had a little bit of money, not a ton. And I did that when I had, literally a son who was 2 years old and a baby on the way. So my wife luckily was very supportive of that, which was awesome. And and then the short version is like now, 4 years later of this cash-based practice, we have our own standalone clinic. We have a second office here. We have 3 PTs and an office manager, all doing the cash-based, what I call the performance-based cash model, and just loving it and thriving. And something I never, I thought would, this is when cash PT was like non-scalable. Nobody thought they could go beyond one person. And obviously proving that wrong. And then, now obviously having the opportunity to help other physical therapists kind of through our mentoring and coaching programs to, do the same thing I did, which is, people that want to go this route, give them the opportunity to do so, give them the sales, marketing, and business advice, which we do not get in school, and be able to teach some of those skills to some of those people.
That's awesome. I love it. And I remember, I think, a couple months ago, I joined the PT Entrepreneurs Facebook group, and you had reached out and asked me, what's keeping you from doing this? And I didn't really have a good answer, but you had mentioned that you started your clinic when you had small kids, because that was something that was my concern. I have a 3.5-year-old son and a almost 1-year-old daughter. And so, I mean, that to me, and it was probably, just a conversation you had with somebody who joined the Facebook group, but to me it stood out, and I was like, okay, like there's really not a reason to not do it. So, my clinic is Flourish Columbus in Indiana, and we just opened our doors to clients on June 1st. So,
congratulations. That's amazing.
Thank you.
I love to hear that.
Global pandemic, great time to go for it. So,
never an ideal time, but doing it is the first step. That's huge.
Yeah. And if not now, then when? So here we are. Okay. So when you decided to make that switch and go to your cash-based, kind of performance-based model, how was the buy-in for prospective clients? Do you feel like you had to do a lot of education on that model? Kind of were people already thinking that way? Talk to me about how you got people to kind of understand the benefits of cash-based PT.
Sure. I mean, from a logistical standpoint, being in both models has been really advantageous. In an insurance-based model, the barrier to entry is very low, right? Like typically your doctor tells you have to go, you go begrudgingly, right? And the person's typically not bought in, right? And they're paying a very low amount. And there's this old adage where if you pay attention, right? So like, if I buy a really nice car, I don't want anyone to scratch it. I don't want anyone to touch it. I want to keep it clean. But if I buy a very old beat up car, it doesn't matter as much, right? And so the same thing I think applies to our health, right? And so, the first thing I saw is the barrier to entry is a lot higher. So as you said, educating patients and getting them to be what I call informed buyers, and really getting to understand all the benefits that come along with our model of them paying cash and us be able to have a direct one-on-one relationship with them is huge, right? And so the biggest thing is that we focus on, from a logistics standpoint, is obviously same therapist, one-on-one care, we're not burnt out, things like that. Those are easy, but the intangibles that people don't understand is the holistic nature of us being able to not only just rehabilitate people, but understand what's going on in their lives, be able to help them reach their specific goals, right?
Yeah.
And there's nothing stopping us doing that. And that's what people care about, right? If
Yeah.
you could guarantee them a result, they're willing to pay anything, especially somebody who's in back pain and unable to work out or unable to lift their children or just unable to
Right.
walk on the street. And so as soon as you get them understand that, we're completely goals based and, you're here and you want to get to this point and we can, say guarantee the outcome, but like we can really push that needle forward regardless.
Yeah.
And as soon as you get that buy-in, then it's over,
I love it.
and they're all
Yeah.
in. That's,
Yeah.
then you get that compliance. They're going to do their exercises, they're going to really pay attention to the education,
Right.
that you give them. And that's really what healthcare is all about, is especially in the orthopedic world, is just educating the patient and getting them to understand what's going on with their body and how they need to move forward. We're just really a guide when it comes to this,
Absolutely. Yeah, that's awesome. So then is more of your marketing based, like client, customer base marketing? Do you do any marketing to physicians or healthcare providers?
Yeah, I mean, I cast a pretty, let's call it a wide net, right? And
Yeah.
so, we do a lot of content directly geared towards, again, educating patients. So we're like, what is low back pain? Like information on what MRIs mean and what exercises they can do to help themselves. Like, if you went to our YouTube channel that has 800 videos, you could probably heal yourself of most of your injuries, right? And so, I just give as much information as we can out
Yeah.
completely. I'm really passionate about that. And then, usually again, we can kind of, once people are educated, they want to come in and they want to just get the plan. Like, what's step one, what's step two, and that's where we come in. So that's a lot of the patient education we do there. We also do a lot of free workshops out in the world, right? And so we do workshops in CrossFit gyms, we do workshops, personal training studios, yoga studios, group training.
Okay.
We've done them in offices. It's just like free information again of just like, hey, you've got knee pain, what's going on with that knee, and how do you prevent knee pain? Or if you're a big runner, maybe what's a really intelligent way to increase how much training you're doing if you're training for this marathon without injuring yourself. Just things like that. A lot of free education. And then I do a lot of what I call local relationship-based marketing. So I will drop into fitness facilities, spend time with them, hang out with coaches, hang out with gym owners, take them to coffee. I started a local podcast that just has other health and fitness professionals on my podcast. And all I do is interview them and talk to them and again, give out free information so people can be educated.
I love that. That's awesome. Great. Okay, so along with the cash-based model, the fee-for-service buy-in, do you have a lot of clients that ask for like an invoice or a receipt to try to submit to insurance? How does that work for you in your clinic?
Sure. Yeah, I mean, we tell everybody, that we're technically what they call out of network with insurance companies. So, if they come in, they pay us for the evaluation or any appointments, we'll provide them with a super bill, and that super bill we provide to them and they can submit it to insurance and possibly get reimbursed. There's a lot of cool applications out there now, things like Reimbursify that make it a little bit easier for people, but most of the time, they need to go and fax and send their information. And some people get reimbursed really, really well. It kind of depends on state to state insurance. And, some people may not get reimbursed at all. It's honestly a small percentage of people that actually submit the paperwork because they got the outcome that they wanted, and it's easier conversation when they have good out-of-network benefits. It's an easy conversation when they have an HSA, because that's something that's covered. So, that's usually the process we go through.
Okay, good. Very good. So along that same line then, do you work with any of the Medicare population?
So not directly. And this is somewhat of a gray area, right, for a lot of physical therapists. So we will typically work with you more in the preventative or more in the performance fitness-based realm, right? And so, if somebody's coming in and they're just looking to do some strength training, looking to get stronger. They want to be able to get up off the floor, play with their grandkids. We're an ideal, perfect fit. But somebody who's
Yeah.
post-op knee replacement, I would typically say, hey, like, you're a really, really good fit for an insurance-based clinic. Maybe come see us afterwards when you
Right.
want to start walking 5 or 6 miles, or you need to go, on that vacation and start walking a bunch of
Right.
stairs or hiking or things like that.
Right. Good. Good. Yeah. That's the Medicare thing has come up a lot in our conversations because it is such a gray area, but heard a lot of people kind of more in that wellness, preventative kind of performance model with our Medicare clients.
Yeah, I mean, I always tell people this too, right? If somebody comes to you and they want to work with you one-on-one and they have severe back pain and they're a Medicare person, right? And you treat them, let's say 6 visits, and they have their back pain is gone, is that person going to sue you? Is Medicare going to say, how dare you get that patient better in 6 visits? Like, I just don't think it's going to happen, right? And so
Yeah.
when we have we want to be as close as possible. Obviously, cash PT is very new and it's a gray area, but, and I try to do the best I can, but at the same time, I'm focused on one thing, and that's getting the patient better, right?
Yeah. Yeah. So when you started your clinic, where was cash based in Charleston pretty new? Were there other people kind of out there doing it, or?
I didn't know there was only one clinic that I knew of, and they were they've been established for like 5 or 10 years.
Okay.
But yeah, I was pretty much the second one, I guess. And I knew
Okay.
that some other people had maybe kind of tried and then it just didn't go well and they went back.
Yeah.
But yeah, we were pretty much the second one. Um,
Nice.
yeah, it's just still not common, right? Like,
It's
let's
not.
it's in the thousands, like how many cash-based physical therapy, like there's really not tens of thousands, so it's still in the thousands, maybe 5 to
Yeah.
6,000. I'd be really curious if, getting that data would be very difficult, obviously, but it's still
It
fairly
would.
new.
It'd be very interesting though, because I mean, in my area, which is Columbus, Indiana, so we're like an hour south of Indianapolis, an hour north of Louisville, Kentucky. So kind of in the middle there of between those 2 major cities. And I mean, there's maybe one other therapist that is a cash-based therapist and kind of has her own niche population that she sees. And I mean, people here, they're super interested and love the idea, but they're like, now, wait, what? How does that work? Can you do that? And I've even had colleagues that are like, you're doing what? We can do that? Like, yes, yes. And I mean, I honestly wouldn't have known much about it except for social media. So everything that, people who have gone before me are putting out is just been, eye-opening. So yeah, we're just trying to spread this cash-based love across the internet.
Yeah. I mean, we're trailblazers. Let's be honest, right? So like, it's just
Yeah.
the first, couple thousand, or we're all new to this, and it's amazing how many people don't know about it. It still kind of shocks me, and even getting some pushback from other physical therapists.
Yes.
They may even think that like, hey, what are you doing? Is that even ethical, and things like that? And
Right.
it's just really interesting, and it goes back to the conversation of what physical therapy actually is, and how we view our own profession, and how we
Right.
view actually charging money for what
Right.
we're worth. Actually, it's just really interesting. We have all this direct access now. We have all these freedoms, and we have doctorate degrees, and it's just like, but we continue to be, and this is the truth, subservient, in my opinion, to medical doctors and things like that. And it's not that I think we're better or they're better. It's just like, we provide a very specific value, right? And
Yeah.
it can be very beneficial for the right person. And I think we should be going after that. We're pretty much 90%, 95% direct access, right? Which is like unheard of. People are like, how does that even work? Like, you get 10 evals a week. Like, where do these people come from? It's like, it's just, it's from just creating really great relationships and putting good
Yeah.
content out there.
Putting
And
yourself out there, and yeah, absolutely.
chiropractors been doing it for years, right? Like, why can't you
Yes.
do it? So
Yeah.
it's
I
interesting.
think part of it, it's just such a shift in the healthcare model as we generally know it. It's okay, I have a problem, I'm going to go see my healthcare provider, and they're going to provide me with XYZ treatment, which may include physical therapy. And it's, I think for my business partner and I, we really just wanted to say, hey, we don't need to go through that whole rigmarole. If you're having issues, why not just come here and let's nip it in the bud? And, and then if you're having other issues down the line, we can take care of that too. And it's just, for the few wonderful clients we've had in our doors initially, they've really been like, wow, this makes sense.
Yeah.
This is the way it should be. And, for me, I'm just like, yes, okay, other people get it. It's nice to have that baked in.
It's a big deal, and you get that affirmation, right? So like you more than likely save somebody like that thousands of dollars, hours of time, possibly needless surgeries or shots or medication.
Yeah, other interventions. Yeah,
Yeah, and
absolutely.
it's just a shift, right? So like we live in a
Mhm.
world of instant gratification. Fix me, rip that thing out, put something new in, just give me
Right,
something so I can keep going. And
right,
the shift is happening where somebody's like, hey, we have this amazing human body. It can heal itself. Where do I go find somebody who can help me do that, right? And I
right,
don't really need another surgery and things like that. And still a
right,
small minority of people, but like, there's hundreds of millions of people in there. It's not like I need a very high volume of people. I need actually a
right,
very small volume of people. So,
right, right.
that's the key, is just finding the right people who are
Oh yeah.
ready for what we have, and
Mhm.
unfortunately it's usually people who've been in the system, haven't had a great result, and then like we're like, oh crap, like I need something different, and then they come.
Right,
So
right. Yeah, yeah. And I think too, with the shift of coming to this more kind of preventative based model, or taking care of things, kind of taking your health into your own hands, people see the value as well of preventing it. And okay, what can I do to continue being active and having a healthy lifestyle so I don't get myself in this situation again? So I love, having the freedom to expand upon that with people.
Right. And that's why usually our ideal client is in a gym, right? They're in,
Mhm.
and it's cool because the rise of what we're calling like these boutique gyms is
Yeah.
huge, right? And so
Yep.
like, it's just like, an outpatient clinic, we refer to them as mills, right? Very high volume, lots of people, 2 to 4 people an hour, just like a global gym. It's a mill. There's a lot of
Right.
people not as bought in, low barrier to entry. So, it's the people who again want to be preventative. They want to be able to take control of their health in their own hands. They want
Hmm.
to be educated. They don't want to just some sort of passive modality. They want to know what's going on with them, why that's
Right.
happening, and we're the perfect people to do that. I mean, think of any
We
other
are.
prevention. There's really not any other. I mean, there's probably some really good personal trainers that could do something
Hmm.
similar, or really good chiropractors that can do some
Yeah.
of the stuff that we do, right? But like, we are literally, in my opinion, the perfect people that are positioned for something like that, with our,
Absolutely.
musculoskeletal background, the way that we have been trained as far as the one-on-one treatment. It's just like, it's the ideal scenario. And I say this all the time, it's like the golden age for the cash PT, because everything is being primed. And yes, this pandemic has been tough for a lot of people, but I
Hmm.
also think that people are going to seek us out even more, because they want to be in a room full of 60 other really, really sick patients on a regular basis? Or do you want to
Right.
come to my clinic where our therapists see 4 to 5 people in a day, right? And our clinic at most will have 2 to 3 people in it. Like, that seems really, really attractive right now for most people.
Right. Absolutely. Absolutely. So any regrets? Anything you regret, would have done differently?
I don't think so, to be honest. Not
Yeah.
doing, I mean, I would say like not doing it sooner, but I really think that this was the timeline I needed to go through. It took me a
Yeah.
while to kind of get to this point. I needed to kind of learn the business side, kind of learn what not to do, so to speak.
Yeah.
I think
Absolutely.
the timing was was right. So no, when it comes to this specific, has maybe some other regrets in my life, right? But like
Well,
mostly, as far as this is concerned, I mean, I've been very lucky to be able to follow my passion, to be able to impact a lot of people, whether it's patients or now obviously other healthcare practitioners.
yeah,
So
yeah.
it's an amazing place to be in.
I love it. I love it. Yeah. I think, too, our previous experiences in our professional lives really shape what, who we become as therapists. And sometimes we need that time spent in different models, doing different things to really, yeah, like you said, understand some of those ins and outs. So that, I love that. All right. Another thing we end on is a clinical pearl. So a clinical pearl for clinicians wanting to get into their own cash-based business, or a clinical pearl for a client, or both, one of each. Give us your best little wisdom nugget.
Sure. I mean, what I focus on clinically, and it's funny how my clinical style has molded and changed over the years, right? And so, what I focus on now is kind of the idea, and it's a fairly new idea, and hopefully more clinicians are getting educated on this more, is that the idea of the therapeutic alliance, right? So like what I focus more on now is my relationship and my understanding of where my patient is in life and where they want to be. What are your
Yes.
goals? What are you trying to do? What's stopping you from, from exercising more? What's actually stopping you from running, or, really understanding where they are as a person, what beliefs they have. So I spend, when students come to shadow me, I spend more time talking in my sessions than doing exercises or treatments, because it's just, that piece is just so incredibly important. The body does a great job, of healing itself. Like I could go back to probably me clinically 10 years earlier and be like, how did these patients get better? But they got better, right? Not to say that what we do isn't valuable from a treatment standpoint, but
Right.
really understanding where the patient is, and developing that therapeutic alliance, getting them to buy into you and buy into your plan of care is just so important. So I've been harping this for a while. Like our clinical skills do matter, but what matters more is our buy-in with the patients, our ability to connect with our patients, our ability to, understand where they are and how to get them to where they want to be.
Awesome. I love it. I love it. All right. So if people like what you're saying, how do they find you? What's your social media? What's your website? What's your clinic? Let's give you some space to plug.
Sure, I appreciate it. So
Yeah.
the easiest place is probably on Instagram. It's a pretty simple handle. It's called @PTBiz. Pretty active on there right now. I'm doing this project where I'm doing 365 days of business coaching tactics, which is
It's awesome.
I
It's
appreciate that.
awesome.
Yeah, I just finished all the way to 365, so all those have been recorded and done. So they're coming.
Congratulations.
Yeah, I appreciate that. So that's the easiest place. If you want to find the clinic, it's Made to Move PT, and it's the number 2. So Made to Move PT with the number 2, and then madetomovept.com and
Awesome.
physicaltherapybiz.com. Those are the best places. And then, easy plug, if you're interested in this cash-based, performance-based world, you just want to learn more. Most people probably find us through the podcast, which is the PT Entrepreneur Podcast, which Danny Matei, my business partner, he's the one who does that,
Yes.
kind of the thought leader in that space. So that's a great place to kind of, start at one. He records two a week. So it's a lot of content, but it's all super valuable.
It's awesome content. Yes.
And he has a
Absolutely.
great book too, if you want to check it out.
Yes.
I can't
Yes.
say the title of the book, but F Insurance, you can assume what the F stands for.
Let's see. I might have a copy of it here.
Love it.
It's somewhere else in my mess of things. But
Yeah,
yes, it's an awesome book, was huge in my personal decision to burn the ships and go for it. So highly, highly recommend the content that you all are putting out. I love it. I'm so thankful for it, just from my personal benefit.
That's awesome here, because sometimes you don't get, in the social media verse, you don't really get that immediate feedback like you do with patients. So it's still new terrain for me. So I do enjoy the feedback. So thank you. I take it to heart. Appreciate it.
Awesome. Well, thank you guys for tuning in for another series in our Why We're Over It cash-based PT episodes here. I'm Dr. Kelly Weisner with Flourish Columbus, Indiana, and we will see you all next time.
Thanks for having me.
Okay,